I will begin by reading an excerpt from an article on parenting a child with ADHD. Dr. Sever says a child with ADHD fails to comply not because she is defiant, but simply because she becomes distracted from the task at hand. Distractibility is a common symptom of ADHD, something that the child may not be able to control. And when you repeatedly punish a child for behavior he can't control, you set him up to fail. Eventually, his desire to please you evaporates. He thinks, why bother? The parent child relationship suffers as a result. It is best to simply remind your child of the test and watch them complete it and follow that with positive reinforcements. Instead of always getting on your child about their negative behavior, try coming up with solutions with a child as to not deter them. I do not agree with just ignoring the child and hoping the behavior goes away. A child does not need to just be alone and essentially ostracized. Talk it out with the child. Your attitude is becoming a problem. Why are you angry, acting out? What can we do to fix this together? Explain why the task must be done. I see you have not cleaned the dishes. They need to be cleaned. Or we will have ants and rodents in our house and become sick. No one wants to be sick. When it comes to child phobias, therapy is the best intervention. If a child has nyctophobia, irrational intense fear of the dark, or aquaphobia, irrational intense fear of heights, I, as a parent, wouldn't not want to sit in the dark or on the roof with them and try to work out their emotions and anxiety. That may be a bad reaction, and then distance themselves from the parent for being mean. That, I believe, is the therapist's job, and they may use desensitization or exposure therapy, which is a type of cognitive behavior therapy. If a child has a defiant, aggressive behavior, I would discipline, not punish. Discipline is meant to teach, while punishing is more or less out of an angry place. Discipline a child with love, as defiance stems from a disconnect. Talk to the child and ask why they are saying no and acting out. As parents, we sometimes tend to take things personally and become argumentative and with our children because we are the bosses and what we say is law. That is not a positive way to go. When we act calmly, the child does not have any resistance to go against. They are left having a screaming match against no one and eventually will get tired. After they calm down, once again discuss the behavior and sometimes take away a toy or device may be necessary. For example, if a child decides that they do not want to eat their vegetables and throws the food, ask them why are they screaming in a calm voice. And after they're fit, help them to clean the veggies off the floor. By help, I mean get a trash bag and pick up one or two pieces while they do the rest. As a parent, I would fix them some more vegetables and explain the benefits and ask if maybe they would like more seasoning or sauce or cheese, something to make it more desirable. The next time vegetables are served and they do not put up a fight, I would offer some type of positive reinforcement and explain that sometimes when we behave, we get treats. Not all the time. And go on to tell the child that they won't ever know when a reward is coming. So it is best to always behave. I believe that some limitation to these interventions come with the child's age. After a certain point, children no longer care about reinforcements, especially during the adolescent years. The child may lose respect for a parent that is always talking to them calmly. If they see other parents yelling, does my mom not have a backbone. My dad is so passive. Or they may actually gain respect and the bond is strengthened when they see how much more aggressive other parents are.